maybe it was better
so I
before?
think the hospitals at the pre-op assessment do tell patients to shower in Hibiscrub. I think they do that.
Okay, so I'll tell you the issue we've had in the past. So the way it normally works is that, sorry, I'm just going to plug in my phone so it doesn't die. The way that it should work, has worked, is that patients arrive before surgery. They have a swab for MRSA, methicillin-resistant Staph aureus, which is a bug that may be living up your nose, up your schnozzle. And we don't like doing implant surgery if you have MRSA without eradicating the MRSA first, because if you were to get an MRSA infection, it's really very difficult to address, and it can be difficult for your implants. So if you have MRSA, we like to eradicate the MRSA in advance, which normally involves a few days of showering with Hibiscrub, and there you go, removing it from colonization. And it will return at some point, possibly, if you're exposed to it. MRSA is not much different from normal SA, Staph aureus. It's just a bacterium that looks, as far as one Staph aureus is concerned, MRSA is its cousin, it's its brother and sister. They can't tell the difference. The only time they're any difference is when they're living in an environment when they're exposed to antibiotics, and then all the normal Staph aureus snuffs it, the MRSA doesn't, and its population increases. So it can be associated with antibiotic use. It's just a resistant bug. Anyway, we'd get you in, we'd do your swab. It's either negative, don't need to take any action, or it's positive and you need to sort yourself out. However, what with COVID, and sometimes actually even pre-COVID, just with the pressure of work, MRSA swabs were coming back too close to the surgery to then have the required numbers of days of Hibiscrub washing to permit you to have, done what you need to do to eradicate it. And so that happened once or twice with some of my implant patients, actually, and I started to say, look, you know what, just do it anyway, a few days in advance. So there you go. And if the hospitals are now telling you to do that anyway, then fair enough.